Hi, my name is Linda. I'm one of the social workers here at West Coast General. This is my coworker Marianne, and we're going to give a bit of information today about social work services at West Coast General. Okay, social workers in acute care must be registered with the BC College of Social Workers. Only fully registered social workers are permitted to practice social work in acute care. So that would be across Island Health sites. And in terms of our registration with the BC College of Social Workers, here are a few of the ethical priorities that we practice under. Our practice is in the best interests of a client or patient. We focus on the intrinsic worth of clients and patients. We carry out our work with integrity and objectivity. We're required to pursue 40 hours a year of professional development to keep our skills and competence up to date. Maintaining confidentiality is obviously a huge ethical responsibility. Demonstrating professionalism in our work with clients and colleagues. Advocating for change in the best interest of the client and for the overall benefit of society.
What is the role of social work in acute care? So equality and equity are two of the, what are they? We're going to have to cut this part. What are those?
We focus a lot on equity rather than just equality, rather than just treating people as if they're all equal, as if they all have equal access to resources and that they're starting from an equal point. We recognize that they aren't, and some people do need different treatment to help them have an equitable health outcome. So the picture sort of shows, instead of having the 3 boxes of equal heights, having boxes of different heights to be able to help all 3 people achieve the same outcome, which is to see the gain.
Some of the social determinants of health that social workers strive to focus on in terms of reducing inequalities or inequities in health outcomes are income, employment, housing, social safety net, food security, early childhood development, gender and sexual identity, Indigenous status, race, environment, education, geographic location, and access to health care.
So how do social workers address the social determinants of health? The first one is utilizing evidence-based interventions and strategies to address the social determinants of health, including trauma-informed care, culturally competent care, and person-centered approaches. Advocating at the micro and macro levels, so at the level of the individual and then more at a societal level as well. Providing information about people's rights and resources. I often say to people when I'm meeting for them for the first time, part of my role is to help you get everything that you are entitled to. And then submitting referrals and applications to programs and services that would help the client to achieve better health. So that's social work overall, and then we can talk specifically about us at West Coast General.
So there are 2 of us. I'm in emergency and psych, the 2600 wing. It covers med surge, 27 and 2800.
That labor and delivery.
Labor and delivery, 2900, and ICU, 2100.
Mm-hmm. So people will often ask then, specifically at our site, how would they connect with a social worker? If the patient is physically in the ER or on the psychiatry unit, you would contact Marianne, and her local is there. For patients on med-surg, labor delivery, or ICU, you can contact me at 48822.
Where can I find the social workers? So that's a picture of our offices. We're pretty much across from the Playhouse. I'm 2103, and
I'm so sorry.
That's fine.
Okay.
Are you 2104?
Yes.
Yeah.
Sorry, there we go.
That's fine. You're 2102, and I'm 2103.
Yeah, just beside the home care workers or CHS liaisons in 2024.
We're on site Monday to Friday, 8 until 6:30. Not coverage on the weekends or stat holidays, but we do We are here Monday to Friday, 8 till 6:30.
And how do I refer to social work? So anyone can refer to social work. It can be a patient, it can be a family member, it can be any staff, whether it's a physician, nurse, one of the multidisciplinary team members, anyone can make a referral. Social workers should always be contacted directly by phone, in person, or email. At West Coast General, there is no system for paper or fax referrals the way that you would find at some other sites. It's more that direct communication.
And we probably should emphasize that putting a note in the file will often get missed. So please do let us know by phone or email.
And that is a good segue into this part.
Ah.
How not to refer to social work. So the least effective way to request a new social work referral is to make a note on the patient's electronic chart under informal team communication or situational awareness. People may ask why is that? Essentially, we only look at charts after we've received a direct referral. We don't audit all of the charts of the patients on the unit. We'll only access a chart for privacy reasons after we've received a referral. So when a person writes a new referral for us under situational awareness or informal team communication, we won't see it, or at least not until we eventually receive a direct referral. So sometimes we'll look at a chart and be like, oh my goodness, someone actually put a referral here to us 3 days ago, and we didn't know it because we didn't actually get a direct referral. We had no idea that there was a kind of a message there waiting for us on the patient's chart. And then the second runner-up in terms of least effective ways to request a new social work referral is via a red button on the board in the structured team report room. Those red buttons are only a reminder of an existing referral. They're not a referral by themselves. So sometimes we'll come in the morning, we'll see a red button by a patient's name, and we have no idea what the red button is for because we haven't received any kind of message or communication about it. Okay.
When should I call social work? So some of the things that you might want to reach out to us about, and if you're not sure, just reach out.
Mm-hmm.
We can always discuss it. Our adult guardianship, suspected abuse, neglect, or self-neglect of vulnerable adults, 19 years of age and plus. Child welfare concerns, including under age 19 would be the children. Identifying next of kin or substitute decision makers. Issues regarding financial stress, lack of income, loss of income due to health, medication costs and coverage, MSP coverage, ICBC and WorkSafe claims, family conflict, impending discharge planning or causing distress to the patient, violence and assaults, legal issues, conflict with the law, court dates, incapacity planning, including power of attorney, wills and representation agreements, housing insecurity, not being housed, pending eviction, late rents and conflicts with landlords, insufficient housing, inaccessible, possibly due to changes in health or mobility, transportation to medical appointments, and code blues, support to family as needed, death in hospital, especially if there's no known family, and supportive and crisis counseling.
Okay. And something that not very many people may be aware of is that both of us are designated responders for Island Health under the Adult Guardianship Act. So similar to how we would know of child protection workers, we would be probably the closest equivalent to adult protection workers here at West Coast General. So if there is a concern about abuse, neglect, or self-neglect of a vulnerable adult, whether they're vulnerable because of the physical health or their cognitive health, we can actually accept those referrals. So that's our duty to look into those. The ways that we might respond would be interviewing the adult about their situation and their goals and wishes if they're able to participate, gathering collateral from involved parties, Sometimes that would be family, friends, neighbors. It could be other care staff, like a family physician. Sometimes it's banks that we would be reaching out to try to gather collateral. And then referrals to relevant agencies and community organizations to try to reduce the harm to the adult. And in some cases, notification to the police or the public guardian and trustee whenever there is a suspected or alleged crime taking place. And then questions.
Questions. Okay.
Yeah.
Do you guys also offer debriefings to staff members after a traumatic code? Like if the staff members might be struggling as a group with how the code went down, or maybe something traumatic to do with the code?
We don't typically, as part of our role, we could do it on an informal basis, but in terms of like actually having a group of staff gathered together, that would be more probably leadership to arrange to have someone. Lydia may do some of that in her role, I'm not sure, but we've in the past had different staff come to us one-to-one wanting to debrief a certain situation, whether it's a patient who's harmed themselves in the hospital or something difficult that has happened in interaction on the unit, maybe with a patient or family, and we can absolutely debrief those things with staff.
Okay. If staff do suspect abuse is taking place with like one of their patients, they are to come and contact you guys directly, and then you'll intervene. And
yeah,
okay.
It's very helpful having that collateral. We will often get concerns of maybe a nurse may call and say, you know, such and such a patient in 2715, their son was in yesterday and the son was yelling at them a lot, and I don't know what was happening, but I kept hearing that there was something about money. And that is so helpful for us to know, just a voicemail letting us know the situation, or a referral, and then we would read the notes under situational awareness about exactly what happened. That information is very helpful to us. Yeah.
Awesome. Well, thank you very much for your time today, ladies. I really, really appreciate it.
Thank you.